Dynamed.com, a leading authority in patient education, presents this video to help patients and their families better understand their medical condition and its management.
When I first noticed there was a problem, I do a lot of weight training, and I was using this one particular piece of equipment, and it was the range of motion got to where I had a lot of pain, so I thought I'd pulled a muscle, so I continued.
The normal shoulder joint is a very elegant, complex machine. It has the most mobility of any joint in the body. The ball and socket design of the shoulder allows the arm to rotate, enabling us to reach and swing our arms, hit or pitch a baseball, use a tennis racket, wash our hair, and lift and carry a child. It is because of the flexible design that we're able to use our hands and arms in so many different positions. The design of the shoulder joint gives it great range of motion, but limited stability. It is prone to injury as we age. When injury or conditions such as arthritis, tendinitis, or bursitis affect the shoulder joint, pain and the loss of mobility result. To understand injuries to the rotator cuff tendon, it is useful to consider the anatomy of the shoulder. The shoulder joint is composed of 3 bones: the clavicle or collarbone, scapula or shoulder blade, and the humerus or upper arm bone. The tendons of 4 muscles form the rotator cuff, blending together to help stabilize the shoulder, along with the joint capsule and ligaments, which connect the humerus to the glenoid. Tendons attach muscles to bone and are the mechanism enabling muscles to move bones. It is because of the rotator cuff tendons, which connect the long bone of the arm, the humerus, to the scapula, the shoulder blade, that we can raise and rotate our arms. The rotator cuff also keeps the humerus tightly in the socket or glenoid when the arm is raised. Another important structure within the shoulder joint is the bursa, or lubricated sac of synovial fluid, that protects the muscles and tendons as they move against each other. The bursa simply allows the moving parts to slide against one another without too much friction. Inflammation of the bursa is known as bursitis, another condition causing shoulder pain. As we age, rotator cuff tendons can be subject to a great deal of wear and tear, resulting in the gradual degeneration of the tissue. Activities requiring overhead reaching put particular pressure on the rotator cuff tendons, and any form of repetitive movement, chronic misuse, or repetitive stress may result in a condition known as impingement. Impingement syndrome is the improper alignment of tissue or bone that results in rubbing or chafing. The areas of poor blood supply in the rotator cuff tendons make them especially vulnerable to degeneration with aging. This may help explain why the rotator cuff tear is such a common injury in later life.
When I first had these problems and went to the doctor, they were suspicious of what it might be and thought, well, we'll just try anti-inflammatory. And for about 3 weeks, see what happens. I'll return to the doctor. No improvement, so we tried some stretching. Did that for about a couple of months, still no improvement. So then I go back, and then he decides, well, might ought to do a little bit more examination, and then recommends the MRI. And then that shows the real problem.
Most shoulders with rotator cuff tears have a history of other problems. The same problems that caused the rotator cuff tear have most likely affected the rest of the shoulder. Diagnosis and treatment involves addressing these related conditions, such as arthritis, bursitis, tendinitis, and acromioclavicular AC joint arthrosis as well. The conditions may overlap and share common symptoms, such as a catching sensation when you try to move the arm, stiffness or chronic soreness, and the presence of bone spurs. On some occasions, cuff tears are gradual and progressive, producing no apparent symptoms but an increasing weakness in the shoulder joint. There may be tears affecting both shoulders. Rotator cuff tears can usually be identified fairly easily in a physical examination. Signs of a complete tear are often quite obvious. A special test called an arthrogram is often used to affirm a rotator cuff tear. For this test, dye is injected into the shoulder joint before x-rays are taken. If there is indication that dye has leaked out of the place where it was injected into the joint, there is likely to be a rotator cuff tear at that location. The MRI scan is a special radiographic test that is now frequently used to examine the rotator cuff tendons and determine whether or not they're torn. With an MRI scan, magnetic waves are used to create pictures that look like slices of the shoulder. Unlike X-rays, which show only the bones of the shoulder, the MRI scan shows tendons and any damage to them. Surgery is normally recommended if a rotator cuff tear makes it impossible to raise the arm by itself, or if the shoulder pain does not respond satisfactorily to conservative, non-operative rehabilitation. The timing of surgery also depends on the extent of the damage to the rotator cuff, as evidence suggests that repairing complete tears of the tendons within 3 months of injury results in a better outcome. Typical surgery for rotator cuff injuries involves making a 4 to 5 inch incision over the top of the shoulder. The surgeon first removes any tissue that has degenerated or does not appear healthy. Then, a section of the humerus, the upper arm bone, from which the tendon tore away, is prepared for tendon reattachment. The tendon tear is then sewn together and sutures looped through the drill holes to attach the repaired tendon to the bone. As time passes, the tendon heals to the humerus. Another surgical method called arthroscopy is also used to repair injuries to the shoulder. Arthroscopy involves using a fiber optic endoscope to repair the joint. This procedure can be done on an outpatient basis and is used in cases that are not as severe as complete tendon tears. Candidates for arthroscopy include patients who suffer from impingement syndrome, partial rotator cuff tears, partial tears along the long head of the biceps, detached socket structures, or damage to the lining membranes. After surgery, the arm is protected with a sling and swath for at least 1 month, and physical therapy is begun almost immediately. First, using passive exercises, and then moving the arm through a more active range of motion.
And he said he would do the scope, and if necessary, he would have to go in and cut, depending on what was there.
In most cases, a shoulder therapist will begin working with the patient the morning after surgery, demonstrating how to do simple exercises that help prevent stiffness and swelling. Postoperative pain management consists primarily of oral narcotic analgesics or intravenous narcotic analgesics during the hospital stay. If surgery was performed under a regional block using arthroscopy, the shoulder may remain sufficiently numb for the first 8 to 16 hours to require very little in the way of pain medication. The doctor and physical therapist will explain the necessity of limiting sudden and stressful movements to the arm for several weeks or longer. Activities that involve pushing, pulling, and lifting will not be possible, and even the best surgical repair can be damaged if submitted to undue strain. It will be a while before the patient is able to actively lift the arm from the side. During the first 6 weeks or so, improvement to the shoulder is determined not only by surgery, but also by general condition and rehabilitative effort. In many cases, the tendons and muscles of the shoulder have been weakened from prolonged misuse or degeneration, and strengthening them will require a gentle, steady process of changing habitual ways of moving the arm.
Within a month, I started with a physical therapist, and they would also just do passive motion, just a little range of motion, and then as time went on, we went with more and more and more.
Although surgery for rotator cuff injuries is usually without any significant problems, there may occasionally be unforeseen complications associated with anesthesia, including respiratory or cardiac malfunction. The surgery itself may be complicated by infection, injury to nerves and blood vessels, fracture, weakness, stiffness or instability of the joint, pain, inability to repair a tendon, re-rupture, or the need for additional surgeries. Finally, not all rotator cuff tears are repairable. Under certain circumstances, a complete shoulder replacement may be advised. Remember that all surgical procedures are tailored to meet individual needs, and that recovery depends not on surgery alone, but also on commitment to the rehabilitation process.
The surgery is a total success. I'm very glad that I had it, and I would definitely recommend it to anybody that was in the same situation I was.
For more information on rotator cuff injuries and treatment, contact your physician. Other Dynamed.com patient video programs are available by contacting the Dynamed.com website.